This was in conjunction with actions by Mayor Cruzen and Governor Parson. Actually, we will begin revisiting what an opening of government will look like over the next couple of weeks. We expect over this week that the hospitalizations, the ICU admissions will begin to peak. As that happens, we'll be able to revisit what opening the government will look like, what opening up the businesses in our community will look like. We don't want to do it too soon. As Dr. Garza said in his task force presentation last week, we have the past to guide us. We know that in 1918, when they reopened too soon, the second and third peaks were even more deadly than the first. We have to recognize and respect and understand that risk. If the peak of the infections and the hospitalizations happen this week, as expected, we'll see what that looks like, and then we'll begin thinking of what reopening our businesses look like. We're watching the models very closely. We're watching the hospitalizations. We're watching the ICU admissions. We're watching our feedback from our public health officials and testing in the community. I do want to stop here for a minute and say thank you. The sacrifices that our citizens are making are working. Staying at home when possible, wearing a mask when out in public, practicing social distancing is what's keeping this virus in check. We know it's difficult, but we have to do it. This has certainly been a heroic effort across our community. We have many, many heroes. When the worst comes our way, we step up as a community. And I just want to say that I'm really proud of St. Louis County and the St. Louis region for how far we have come. Later this week, we're expected to receive federal funds from the CARES Stimulus Act. With nearly $175 million, we can buy more testing supplies, which is what we need to take care of sick people in our community and to come up with a pathway to reopen our business and commerce. This is a very competitive environment to purchase tests, and we need to be in this environment as fast and as quickly as possible. These funds will also use to pay for hotel stays for first responders who are quarantining away from their families, and we already have contracts in place. We expect to be reimbursing those contracts and those stays from the federal stimulus funds. Hotel rooms are also available to take care of unhoused individuals in our community who are COVID-19 positive, so they can be in isolation, safe, and not without a place to live. The funds will be used to cover overtime for first responders. They'll be used to support our Dignity Transfer Center, which is scheduled to open Tuesday, to provide relief for funeral homes, hospitals, and morgues in the region who might be overwhelmed, and this is an expense that we expect to be reimbursed over $2 million. I've also requested legislation that will create a transparency portal so anyone at home can follow online on all the expenditures that have been attributed to the CARES Act stimulus funding as we begin to rescue our community from this epidemic. We have to spend this money with urgency, but also responsibility. And I look forward to the council approving this bill so we can get started providing that information in an easily accessible way. It's imperative that the public knows how this money is being spent. The more people we get tested, the more they have access to the health care they need, and the quicker we can get our economy moving again. I've spoken with more than 65 of our county's mayors, several who are concerned about the economic impact this is having on our community, and I understand that, and I hear what they're saying. Working closely with our municipal leaders and our business community, planning will begin immediately to see how we can loosen our social distancing restrictions and begin to reopen our economy. We are also looking to see what reopening our parks will look like. I know at this time of the year it's very difficult to not have access to our parks. I hope to have more to share in the next few days about what that plan would be. Responding to this pandemic is a balance between planning for the future, learning from the past, and addressing the challenges that we have here today. That includes stopping the spread of the virus, leaving the stay-at-home orders in place to protect our safety for all of us, and providing wider access to testing. We can determine how far-reaching this virus is to our community, to our residents, and then with proper care begin to stem the tide of this pandemic and get our economy moving again. We are all in this together. We don't have a cure. We don't have a vaccine, but we do have the ability to stop the spread of this virus in our community. Thanks to all of you for your help, and I'd be glad to answer any questions.
Dr. Page, you alluded to it there about the peak coming here on the 25th. What's your vision for what this week looks like, if you will, leading up to it? Are you expecting a surge of cases? Do you think it's going to be more gradual? I know this is not an exact science, but what's your vision here?
Well, I would refer you to Dr. Garza and his reports from the hospital systems on their capacity, on their admissions, their ICU admissions, their ventilator use, and their discharges. But we expect that to peak this week. It may be a softer peak instead of a spike, but I think we have to wait and see where those numbers are. And when we see those numbers start to fall off, then we know we're headed in the right direction, and we can begin having our conversations about what reopening government would look like.
Do you think that could come earlier than mid-May?
Well, when we begin to loosen restrictions, they will be gradual. So I believe we'll be having the conversation about what that looks like by the middle of May. I'm hopeful that we can begin the gradual easing of restrictions in mid-May. But again, we have to watch these numbers, and we have to watch these hospital admissions and see in what order those restrictions will be unwound. You know, we wound them up in steps, and I would expect that we would also unwind them in steps.
So probably not before mid-May then?
It's really not responsible to try and predict what the testing capacity, what the infection rate, what the hospitalizations will be at the end of this week or the end of next week. And those are data points we need to talk about loosening restrictions. So for me to give you a date would be a little bit like predicting the weather 4 weeks from now. We need more information, we need more data points, we need to know what our testing capacity is in our community. We really need those tests in place, we need that testing infrastructure in place, and we need to know what our hospital capacity is, and we need to understand that we have good supply lines on PPE when we begin to reopen our well, you know, the county council members have always been partners in how we make decisions in our community, and they will always, their opinions will always be important to me. I do believe that trickling this money out over weeks or trying to pass an appropriations bill for every emergency expenditure isn't responsible, and that's not how anyone in this country manages an emergency. That's not how the state's managing it, that's not how any state's managing it. The proper procedure is to get those funds in an emergency fund that can be drawn down from immediately to purchase supplies that we need immediately, and all of those purchases should be displayed in real time on a portal for everyone to see where it's going. And that's the way you manage an emergency. This is not a traditional appropriations process where we can be leisurely in purchasing supplies or anything else that we need.
So if I hear you correctly, you're saying that you should make those decisions without county council approval?
No, that's not what I said.
Okay, I'm sorry.
Those decisions should be made by our emergency personnel staff, my department directors, and everyone else that works for county government, including whoever we have as our partners in the community that are telling us what we need. But we know what we need right now. We need a massive testing infrastructure. We need massive contact tracing. And going back to the council for approval, each time we need to make one of those purchases, delays providing care to our community, delays reopening commerce in our community, and that's not how anyone in this country manages an emergency, and that's not how this is designed. But their opinion on what our needs are is very important to me. I expect to be working with the council members very closely as we talk about what reopening commerce in our community looks like, as we talk about where the needs are in our community for testing and healthcare. I expect them to continue to be my partners and the partners of all county government as we make those decisions. But going back to the council on a weekly basis or every 2-week basis to approve purchasing of emergency supplies is not the right way to do this.
So you're talking about department heads making those calls and then transparently reporting that on that other.
In real time, everyone will be able to follow along on the expenditures and have an opinion about where the trends are going, and that's the right way to manage an emergency situation. And we do have an emergency, and if we do not make decisions promptly, if we do not make purchases of needed supplies quickly, dramatically delay the supply of health care to our community, and it will dramatically delay our ability to reopen government and reopen commerce in a timely manner.
How many tests do you anticipate being able to buy with this CARES money, and at what cost?
Hundreds of thousands of tests in our community over the next year, for sure.
Do you know how much that will cost? Or?
Well, the costs will change. You know, these are all variables that haven't been completely identified. The testing technology changes almost on a weekly basis. There's new tests coming online that are being validated as we speak, serology tests that will measure immunity, and then there are new kinds of tests that that can measure whether or not the virus is present in a person right now, which would be an acute infection. That technology is changing quickly. There are saliva tests, there are serology tests, there are nasal swab tests that are changing. And right now that stuff's pretty expensive. It's $25, $26 a test, so 100,000 tests is $2.5 million. But it's not just the testing materials. We need 2 types of tests. We need to measure immunity, and folks will have to test for immunity more than once, most likely. If they were negative at one point in time and there's a life event that changes, maybe a month or 2 or 3, they need to be tested again. So we need to figure out what those protocols are, talk to our public health experts, but it's not just the purchase of a test, it's the infrastructure to have that test processed, to take that test, to have someone test someone else, to get those test results, and then also the infrastructure focus on people who are positive or who've been exposed to someone's positive, who's positive, and then everyone else can go about their activity and get our business community opening again. But those tests are so important, and that infrastructure of contact tracing is so important to getting our economy open.
Are you hiring more people who can contact trace?
We have an enormous group of volunteers, and we also are planning to hire. Again, I need the emergency money in place so we can do this and other things that we discover along the way and not be delayed by going back to the council each time and say, we have something else, let's process a budget bill, and in 2 weeks we can have the funds to do it. Some of these things are extraordinarily immediate, and that's why we do things differently in an emergency.
One more. The transfer center morgue that's scheduled to open tomorrow. If we do have a softer peak, as you mentioned, how much capacity of that morgue are you anticipating using? I think it's 1,300 that it could hold.
Yeah, the Dignity Transfer Center has much more capacity than we hope we need. And like in any emergency, we plan for the worst and hope for the best, and we'll be prepared either way. It would be great if we don't need to use much of that capacity, but we've seen how this has developed in other parts of the world and other parts of the country, and we want to be prepared.
You said it's set to open tomorrow?
Yes.
But not necessarily taking bodies tomorrow.
I don't know about the day-to-day activity in the transfer center. It will be ready to be used, but I don't know about what the movement plans are.
One thing you brought up there that spiked my interest was you're talking about needing all these tests to reopen the economy. Are these tests that you need to get in with that money before you can move on anything on the economy, or do we have enough tests to get us to mid-May and be able to make a determination about whether we can move forward?
We don't have enough tests now in our community. We have a supply that lets us keep up with testing under pretty tight protocols, and I would like to expand those protocols to be able to test everyone who has symptoms. And right now we're restricted in testing the sickest people. We're talking this week about expanding those to everyone who has symptoms. Beyond that, we need to be testing people who don't have symptoms, and we need to be testing broadly in the community for people who have immunity, which means they were exposed to the virus. They were part of that 25 or 30% that never had symptoms and were positive and are now, we would hope, would be immune. Based on the early science, they would have some immunity.
How long do you think it would be to get tested once you went out to bid for them?
The testing purchasing environment in our country is extraordinarily volatile, and it's very, very competitive, and we need to be in there competing aggressively through different vendors, through different supply chains. We need to have some very aggressive competition in this space. This is not something that we approach leisurely. This is a very urgent and emergent situation to get tests in our community so we can know what's going on and so we can begin to form a plan to get our commerce reopened. I would very much like to start this reopening in mid-May, and it's not responsible to do that unless we have an active testing environment, and we need to move quickly to purchase these tests. The funds will be here from the federal government at the end of this week, and I would like to begin placing those orders this week too.
And do you know when you get tested in though, once you place the orders?
Sometimes they come in a few days, sometimes they take a couple of weeks. More frequently, they send them in batches as they're able to get them. But the production capacity of PPE and testing in our country is not kept up well with the consumption of those supplies. And as the need for PPE and tests starts to fall, as there are less people who are acutely ill and very sick and taking up space in our hospital, then we have the ability to manage the testing environment for people outside of the hospital, and that's what we need to do to be successful in any public health effort, is to have a good testing environment outside of the hospital and take care of people outside of the hospital. And we're talking about not just testing, but how do you care for someone in their home? What sort of resources do individuals need in their home? And I spoke to Dr. Garza about that this morning. I spoke to our health director that this morning. We will be putting together care packages to try and keep people in their home and out of the hospital, so we don't have to be filling up our hospitals with patients who can be managed at home, and so they can safely isolate at home.
Dr. Vick, we have a couple of more questions. There are rallies scheduled across the country tomorrow, including here in Clayton. And there was some activity over the weekend where people were holding large gatherings saying, we want the economy reopened. What are your thoughts on these rallies, and what kind of enforcement, if any, will there be at these?
I understand how people feel. People have the right to organize, they have the right to protest, the right to speak up. I hope that they do it in a responsible way and with proper social distancing, because I would hate to see an opportunity for this virus to spread in anywhere in our community, because we are starting to get our hands around it and we are trending in the right direction. As far as enforcement goes, there are laws regulating protests. I'll leave that up to law enforcement to manage, but from what I've seen, for the most part, these have been peaceful operations, peaceful protests, and from what I've seen, at least on TV, they've been respecting social distance guidelines, and I think that's a productive way to communicate their concerns and their frustrations, and I don't have a problem with it.
There were media reports over the weekend about looks like there's an agreement to move forward on some of the CARES money.
Yes.
Do you see that going forward on Tuesday?
It will. I am frustrated, though, that this bill that's moving does not have relief for local governments. It's very frustrating for me in St. Louis County. It's very frustrating for our mayors. I heard about that last week on a conference call with mayors, that the decline in sales tax revenue is devastating on our governments of our municipalities in St. Louis County, and it's going to be devastating for St. Louis County as well. And our federal government is talking about relief for some of these local jurisdictions that run with small reserves and very tight budgets, and they're going to need that. And I would really hope, we'd all hope that it would be in this relief package that's moving forward, and it doesn't look like, at least today, that it will. It might have to be in the next stimulus bill that comes forward. But we do need those funds, and there has been some frustration, I know, among our municipalities that this $175 million can't be used to replace their lost revenue, their lost sales tax revenue, and it can't. That's just what the law says. That's what the federal law says. If we spend these funds, this $175 million, in a way that's not consistent with the federal guidelines, then they will claw back, and we'll just have to pay it back. There are plenty of needs in our community to help our small businesses get started, to help restart our economy, to make sure we stand up a really robust testing environment and a robust contact tracing environment, to buy PPE, help our first responders, help our nursing homes. There's lots of ways, the humanitarian relief, there's lots of ways to put this $175 million to work in our community in a responsible way. But we do have to stay focused on replacing that lost revenue for our municipalities.
One more question is, do you have any idea how much the county has spent so far on COVID-related?
I hope to know that by this week. Those expenses are fast and furious, coming from emergency fund, coming from our police department, coming from our health department. A lot of PPE, a lot of hotel contracts, a lot of overtime that's currently being absorbed in our personnel budgets, but will have to be paid back, especially as we get farther along into the year.
The $7 million that you talked about last week, is that up for approval tomorrow at the county council? And if so, are you thinking that will get through?
No, I think it'll get through. I think, there's a lot of pressure on our council members by a lot of people who are frustrated with where we are. And we need to move forward and act quickly in this emergency to get people back on their feet. And a delay in processing appropriations in an emergency will delay our access to tests, will delay our ability to reopen commerce in our community.
One more question for me is, what would be your message to those mayors and those business owners and elected officials who you spoke with about the frustration of this? What do you think is important for them to know moving forward?
Well, I think we should learn from what's happening around the world and around the country, that if we don't make the right decisions at the right point in time, then the impact will be devastating. If we manage our social distancing decisions correctly, we manage our public health response correctly, the economic impact on our community over the next couple of months will be much, much less than it would have been otherwise. And so we need to get through this with doing everything we can to save lives, but also keep an eye on getting our economy reopened. My message to everyone who is touched by this, who has decision-making responsibilities, elected official, is work with us. We hear you. We understand your frustrations. We have a plan. We have some federal stimulus money coming. We're going to implement that in a way to shore everyone up and get our economy moving again. And I think the month of May is going to be we're going to see very lot of activity in the right direction and get us back on track.
Thanks, everyone.
Thank you.
My biggest hobby is sewing, so I had always planned